All right, testing. 1, 2, 3, testing. Good morning. We are so excited to welcome you to MPHA's 2022 annual conference, Adapting in Times of Adversity of Public Health and Strengthening Maine's Communities. My name is Becca Bolus, and I'm Executive Director of Maine Public Health Association. We have 3 full days of interesting, inspiring, and cutting-edge programming ahead of us, and hope you've been able to clear time in your calendar to fully engage and participate in the sessions over the next few days. I want to start with our land acknowledgement. Maine Public Health Association recognizes the sovereignty of the Abenaki and Wabanaki Confederacy, the Penobscot, Passamaquoddy, Maliseet, and Micmac peoples on whose ancestral homelands and unceded territories we gather. We recognize that our ability to learn, live, work, and play here in what is now called Maine is directly due to their unyielding stewardship of the land since time immemorial. The American Public Health Association's Tribal Public and Environmental Health Think Tank 2018 report states, quote, "The unique history of forced relocation, intolerance of cultural norms and practices, and discriminatory state and federal policies enacted over several generations has resulted in historical trauma, adverse childhood experiences, distrust, and societal alienation," end quote. Maine Public Health Association stands in solidarity with tribal communities and allies here across the country and elsewhere in the world in recognizing their inherent sovereignty. We are committed to supporting education and policy efforts to further that end, and encourage you to learn more by visiting our website and that of the American Public Health Associations. I would like to thank these MPHA members who volunteered a significant amount of their time over the past several months planning this incredible conference, identifying invited speakers and sessions, reviewing abstracts, and putting together an impressive program. Thank you to Courtney, Carl, Bill, other Courtney, Ellen, and Brittany for your time. I also want to extend a special thank you to Heather Drake, our Membership and Engagement Director, for taking the staff lead in planning this year's conference. Everything from working with our awesome tech team at Event app to creating this engaging platform to collecting speaker materials for continuing education credits. There's a lot that goes into planning the conference, especially when it's 3 days and especially when it's virtual. So I just want to extend again a special thanks to Heather for her leadership in that. Our conference wouldn't be possible without our sponsors, and I want to thank you all so much for your very generous support of MPHA and of our virtual conference. In particular, thank you to Maine Health for sponsoring the virtual platform, to Northern Light Health for sponsoring our keynote speaker, to the New England Public Health Training Center for supporting our plenary sessions, and to Maine Cancer Foundation for supporting our virtual networking room. I also want to thank the Maine Health Access Foundation for supporting the conference through its meeting support grants funding opportunity. I also want to thank our conference exhibitors. As Heather mentioned in her tutorial video, which I hope that you've all watched, you can visit sponsor and exhibitor booths, their virtual space in the platform that allows you to learn more about what they're up to. Some of them have different videos and resources for you to view, links to their website and social media platforms. And you can earn almost 500 leaderboard points by visiting the virtual exhibit hall. So I hope you visit early and often. Thank you again to our exhibitors. As a nonprofit membership organization, our members are integral to our work. We have grown to nearly 700 individual and 60 organizational members, and we want to take time now to recognize our organizational members and thank you for your generous support of Maine Public Health Association. So thank you to our two sustaining organizational members, Maine Health and Northern Light Health. To our alliance members, Let's Go, MCD Global Health, University of Southern Maine, Portland Public Health, AdCare, Educational Institute of Maine, and Health Reach Community Health Centers. We also want to thank our advocate organizational members, Children's Oral Health Network of Maine and the Maine Network of Healthy Communities. We have grown our partner members and are so thrilled that we have these 21 organizations across the state that have joined the association. So thank you all very much. And these 29 stakeholder members. It is really exciting to see the breadth in terms of mission and geography of the organizations that have joined MPHA. And I just want to thank you all again for your support. Thank you too to our generous grant funders. Your collective support allows us to continue our strong public health, education, advocacy, and training efforts. So thank you all very much for your support of Maine Public Health Association. With 3 full days of sessions, there is a lot to be featured. Each day, you will receive a welcome email and push notification in the conference site. So we encourage you to remain logged in to the site each day, even if you have to miss a session or two, so that you can stay up to date on what's going on, including any schedule changes or reminders, last minute notifications. You'll have a better experience if you are able to just stay logged in throughout the next 3 days. There are a few highlights. The first is that we are offering conference captioning services. Within each session, you will automatically be provided with captioning, which will appear beneath the video stream. You can click the link to access it in a separate window if you would prefer. And if you don't need the conference captioning service, you can push the pause stop button to stop the stream. We are offering continuing education credits for both CME and CHES. Please be sure to complete each session's evaluation in order to be eligible for continuing education credits. To earn CME credits, you must attend the session live, and for CHES credits, it's fine to watch the recording. But again, you have to complete the session evaluation for all the sessions that you're looking to seek continuing education credits for. Evaluations are found in each session's description and then in the chat in the session. So you'll have two different ways of accessing the session evaluation. We strive to ensure a diverse array of voices that are heard, included, and that benefit in and from our work. As such, we reviewed and personalized for our organization community agreements, which we adapted from the Maine Philanthropy Center. And I encourage you to review these and consider adopting them for your organization as well. And I encourage you to engage with them as you are working in or participating in our events. Lastly, we have the Leaderboard Challenge, or the Conference Challenge. This is an opportunity for you to earn points for engaging in the conference platform, whether it be visiting our exhibitors or completing different other trivia questions that pop up. And as you accumulate points, you will work your way higher and higher up the leaderboard, and the top earners will win prizes from MPHA and from our partners at Winter Kids and the Natural Resources Council of Maine. So thank you to them for sponsoring some prize pack items. And then today at 12:30, I'll be excited to share some different board updates with you, association updates with you, including updates to our board membership, our policy and advocacy efforts, training efforts, membership news, all sorts of different things going on. So I hope you'll join us today at 12:30 to hear about all of that. So with that, I just want to thank you all so much for being here with us the next few days. I know that there are certainly pros and cons to a virtual conference, but I hope, like I said at the beginning, that you're able to clear some time in your calendar to really engage with the sessions. They are all recorded, so if you do have to step away for a meeting or other engagement, please come back and listen to the recording. We are just very grateful for your time and for all that you do to promote and protect public health in Maine. So thank you for that. And with that, I am excited to introduce our first welcome message from Rachel Levine, MD, who serves as the Assistant Secretary for Health at the U.S. Department of Health and Human Services. Dr. Levine has a storied career, first as a physician in academic medicine focused on the intersection between mental and physical health, treating children, adolescents, and young adults, and then as Pennsylvania's Physician General and later as Pennsylvania's Secretary of Health. And through those roles, she addressed COVID-19, the opioid crisis, behavioral health, and other public health challenges. She is committed to advancing health equity and to achieving a healthier future, one in which every American can attain their full health potential. Admiral Levine is the first openly transgender individual to serve in a Senate-confirmed position. She is an inspirational trailblazer, serving in a critical public health leadership position at a time when we are seeing staggering disparities in health outcomes for transgender youth and adults here in Maine and across the country. We are so fortunate and feel very grateful that Admiral Levine took valuable time out of her schedule to share introductory welcome remarks with us today. Her perseverance, accomplishments, and compassion in the face of adversity are models for all of us. Thank you.
Good morning. Thank you to the Maine Public Health Association for having me here today. Now, COVID-19 has been the biggest public health challenge our nation and the world has seen in more than 100 years. It has impacted our health, our families, our schools, our businesses, our healthcare system, and local, state, and federal governments. I want to thank all of the Maine public health officials, your local and state government officials, community-based organizations, healthcare systems, volunteers and foundations, and by extension your families for the very difficult work that you've been doing for more than 2 years supporting the American people through the pandemic. Whether it is providing accurate information, countering misinformation, or doing testing and contact tracing, providing vaccines, or attending to all of the other things that public health needs to do, while so many of us have had to be prioritizing the COVID response, you all have my personal gratitude and that of the entire United States Department of Health and Human Services. Now, during the pandemic, people have been exposed to an abundance of information from a very large number of sources. While the large volume and steady flow of information from credible sources has enabled people to stay safe and informed throughout the pandemic, at times it has also led to some confusion. It's essential to the scientific process that we update assessments and recommendations based on new evidence. But without sufficient communication that provides clarity and context, it is understandable that people have had difficulty figuring out what to believe, which sources to trust, and how to keep up. Now, health information and health misinformation did not start with the COVID-19 pandemic. What is new is the scale, speed, and sophistication with which it is shared and consumed by the public, and the widespread harm health misinformation is causing to our collective health, enabled in part by technology and especially social media platforms. Amid all this information, many people have been exposed to this health misinformation. During the pandemic, health misinformation has caused confusion. It has created mistrust. It has harmed people's health and weakened our public health efforts. Now, health misinformation isn't just a COVID-19 issue. It threatens our ability to address current and future pandemics and other health challenges. Our health as individuals and as a society depends on having accurate information from sources that we trust and that use the best scientific evidence available. By making it harder for us to distinguish what is true and what is false, health misinformation prevents us from taking care of ourselves and our families, and it undermines our ability to take care of one another. As public health leaders, we have a critical role to play. First, we must continue and expand our work to address health misinformation directly in our communities. This includes, but it also goes beyond COVID-19. Now, recognizing that none of us have an abundance of free time, we have to do more to help get the voices of frontline public health workers out in the public eye more effectively. We've seen how effective our public health community can be when talking to our communities, at town halls, at their children's schools, and in conversations with friends, families, and neighbors. And we need to use our voice as public health leaders to collectively advocate for the most underserved and marginalized in our community as well. Before I conclude, I want to encourage you to work with and continue to work with our regional office representing New England. Region 1, led by Betsy Rosenfeld, is an essential liaison between the communities and the Office of the Assistant Secretary for Health, my office. Region 1 team members, like all of you, are determined to improve the health of people in Maine as they lead councils on health equity, increase community health worker sustainability, and translate the needs of the local level up to our federal level. In closing, the dedication of our public health workforce has shone through during the pandemic, and it will continue to shine as we conquer new challenges. Now, my message today is also that it is important to remember your own physical and mental health. Realize when you need a break and when you're giving too much of yourself. You can only help others if you are healthy too, physically and mentally. So please always stay connected, stay informed, and stay safe.
Admiral Levine, thank you so much again for sharing your warm remarks with us. It's incredible to hear from you and to have you here. We are going to take a short 10-minute break, and then we will be back. So refill your cup of coffee and then get ready for a fun day of learning. Thank you all.
Good morning and welcome to the opening session of the Maine Public Health Association's annual meeting. My name is Tom Violet, and I serve in a senior provider relations role with Northern Light Health, a proud sustaining member of MPHA and sponsor of today's keynote session. Adapting in times of adversity is a very fitting theme for this year's annual meeting. Now, well into the third year of the global pandemic, our Maine communities have been challenged to adapt and respond, and have done so with incredible resolve. And all of us who care for our Maine communities, who work in public health, healthcare, and community services, have made many enduring sacrifices to ensure Maine people are safe and have access to the services and supports they need to thrive. The focus of today's keynote is meeting the moment in public health, workforce resilience, and well-being. I am honored to introduce Amber Norris Williams, Senior Vice President of Leadership and Organizational Performance at the Association of State and Territorial Health Officials. In this role, she is responsible for providing strategic guidance and direction for member onboarding and engagement, overseeing the development and implementation of capacity building and technical assistance services to strengthen and improve state public health leadership, workforce, and performance. Amber began her career as a health educator at a local health department and then worked to build community-based childhood injury prevention coalitions statewide through Children's Healthcare of Atlanta and Safe Kids of Georgia. She served for more than a decade as the executive director of the Safe States Alliance, a national nonprofit organization whose mission is to strengthen the practice of injury and violence prevention. Amber has a bachelor's degree in health promotion and education from the University of Georgia and a master's of science in organizational leadership from Colorado State University Global Campus. Welcome, Amber, and thank you for your generous gift of your time and experience.
Good morning, and thanks so much for inviting me to be here with you this morning. It's always my pleasure to talk with public health workers about where we are in this moment, and so I'm just really pleased to be here with you this morning. So we can jump right in. So ASTO is a national organization that is it works with state public health officials and their workers, and I'm sharing a picture of our recently adopted strategic plan, just as a way to get to know us a little bit, if you don't already, and to know that, you know, I think that we've all been through such interesting times and are really thinking about what is the backbone that takes us into the future of public health. And so as such, you can see in our strategic priorities that are leading us over the next several years, that workforce development is front and center. And this is the first time in my professional experience that we've seen this. And you see this mirrored, I think, as well in the Centers for Disease Control and Prevention's priorities and in other areas. But this is front and center to our work, and workforce resilience and well-being is really central to that. So today, what I wanted to talk with all of you about is burnout, what it is, what causes it, and how we can really begin to address burnout using a public health approach. We, often, think about how are we layering approaches using the best available evidence for any other public health condition. And so that's my challenge to us today, is to really think about burnout and workforce resilience in much the same way. So we can dig right in. One thing I do want to note is that, as Tom was saying at the beginning, we have been through an incredibly difficult time. Both, I think, personally, professionally, and I just want to say that while much of what I'll share with you is very, common sense oriented, I don't think that we should look back on our performance over these last several years with the gift of the hindsight that we have now, and to think that we've done anything wrong if we haven't been using these practices, or to think that if we're not ready yet for some of these strategies, that there is, that's not, what you should be doing as a leader. I offer this in the gift of, when you have time and space to think about many of these things, that maybe something will resonate and will give you a healthier way to move forward. But I did want to note that, this has been an unprecedented time, and I hope and offer this to you in the spirit of options for how we move forward together. But I did want to start with, how are you feeling today? It's Tuesday morning. Hopefully you had a break of a longer holiday weekend. But how are you feeling this morning? So I offer an opportunity just to share in the chat how you're feeling. And as you're beginning to share, I just want to note that, this is a moment where I think it's important for all of us to recognize that we're all coming to this morning, today, this week, with a very different set of experiences. Maybe some of us had a wonderful weekend. Maybe some of us had a very challenging moment with a coworker just before coming to the session. Maybe some of us just had a very difficult month. So we're all coming with a very different experience, and that impacts how we interact with one another. And I just want to share that as we get started.
We're starting to get some responses. We have reflective, life is good, curious. We have some exclamation points, so that's always nice to see on a Tuesday morning. Thankful for the opportunity to be here. Happy to be tuning in here. Productive and energized, a bit distracted. Happy to be here to start the week, energized. See some smiley faces. Present. This is great. Thank you all.
Wonderful. Thank you. I offer this in the spirit of, I want this to be as interactive as we can be on a virtual platform, and to offer a bit of connectedness to each other and with me. I think that's one of the things that we've lost a lot through the pandemic, is the spirit of connectedness. And often when people ask, how are you today? You say, fine, we're good. But maybe there's someone that you could share a little more with today. So that might be something that you do in the spirit of your own resilience and well-being, is connecting a little deeper with someone today. I don't think it's a surprise to any of us that stress and overwork is not actually good for our work. I think we're, all pretty aware, and particularly over the last several years, of the impact of overwork on our overall well-being. Is my screen still sharing? I'm sorry.
Oh, we see your desktop now.
My computer just decided to turn off a little bit. Okay, I'm going to stop my share and try again. I apologize.
No worries.
Are you seeing it flash like I am?
Mm-mm.
Okay. All right. Well, we may have to do this without slides, which is just fine. And I can share that later.
Yeah, no problem.
Okay, well, I'll just keep digging in, and if my computer decides to cooperate again, we will bring back the slides. And apologies for that. My computer was not quite ready for the return from the holiday weekend, I guess, as well. But as I was saying, there's a lot of difficulty in that stress and overwork bring to our work, in that we work less efficiently. The quality of our work suffers. We have poor communication with others, and our interpersonal relations definitely tend to suffer. And as we continue with overwork and experience great stress in our work, it begins to impact the passion that we bring to our work. And in public health, I would say that, like other helping professions, people often bring this sense of mission or personal passion into their work, which can blur the lines of, work and home, and really encourage you in some cases to overwork, even when it's not necessarily required of you, but just something that you feel is important to the what you are personally bringing to your work. So we will, begin to lose that passion that we're bringing to our work just from overwork. And I want to note here that, working more than 40 hours a week only helps in a very short period of time. What we see in the research is that if you are working more than 60 hours a week for you, even as short as, a month or two, that actually the productivity that you bring to your work is roughly that about 40 hours. So when we feel like we can't let go of work, often we are not being as productive or having the best decision making or quality in our work that we would have had we given ourselves some breaks. And so here I want to share with you the definition from the World Health Organization about what burnout actually is. And I found it really interesting in our research is that the World Health Organization actually classifies burnout as an occupational phenomenon, not a medical condition. And it's characterized by feelings of energy depletion and exhaustion, having a increased mental distance from your job or cynicism about your work, and then having reduced professional efficacy. And I think that the reason that this definition is important is because often when we think about burnout, we think about a person and their own personal resiliency, when really a workplace is the cause and condition that creates burnout in individuals. And that, we will talk about ways that you can cope personally. However, I do want to note that none of that is really possible without addressing other aspects of the workplace, especially in a longer term. So what we see about burnout, in terms of why do people burn out at work, there are really five big reasons for that. One is unfair treatment at work, whether that's favoritism or bias, mistreatment, not having trust in your manager or the executive leadership of your organization. Unmanageable workloads, which I think many in public health can relate to over these last many years, even before the pandemic, I will say. When your workload is out of control, you might be looking to your manager or to leaders in your organization for some support. And if they can't help with the prioritization or their workload themselves is unmanageable, that can really contribute to burnout. Lack of role clarity. I would say this is another biggie, particularly during the pandemic, where it wasn't always clear what the expectations were, what accountabilities were. Those were kind of moving targets. That can be really exhausting to constantly be trying to figure out, what are you trying to accomplish? Who are you trying to serve? What does success look like? Again, when we talked about stress and overload, reducing communication efficacy, this is also a major cause of burnout, is not having good communication or support from your manager. In fact, those who feel supported by their manager are 70% less likely to experience burnout on a regular basis. And then unreasonable time pressures. And I offer this in the spirit of maybe we can all go back and look at some of the time Well, good morning again, and we'll try that again. I do have my slides back, and hopefully the computer gurus will stay with me so that we can keep going this morning. So we were just talking about what we see in terms of the top reasons for burnout. And just wanted to note that, there's been a lot of media attention to the fact that the public health workforce has experienced a great deal of difficulty through the pandemic. And again, I would say even before you began the pandemic without adequate staffing and a very increased demand on the services that public health workers provide. And then the support that we received as a public health community was pretty uneven, and I think in early days, there was a lot of support and thankfulness for the expertise that public health brought to the pandemic. And then as, it began to impact, schools and businesses and community connectedness, we began to see a significant backlash, which again is not necessarily uncommon to public health work, but was certainly heightened as we've seen. And then, just the increase in workload is emotionally and physically draining. And all of this can worsen our health and well-being, including our mental health. And when you are experiencing mental health symptoms in a workplace, that can lead to increased absenteeism, turnover. Often people feel like they can't sustain and need to leave those roles, and lower morale and productivity, which is very contagious in a workplace. And that impacts our effectiveness as public health agencies. I want to thank our friends at the Maine Public Health Association for sharing some of the survey responses from a survey that you all recently were part of. And just wanted to note that, in addition to your regular day jobs, many of you were asked to take on roles related to COVID through the pandemic. And so that obviously increases workload and stress. And in fact, nearly 42% of you are still performing duties related to COVID in addition to your regular responsibilities. And more than stress and overwork, I would say that public health workforce has experienced a great trauma. Many of us experienced traumas personally throughout this period, but also just in the workplace, the feeling of being scapegoated, of having expertise challenged, of experiencing some of the vitriol and fears of the public, that's trauma. And so, I think that that's important to know, that it's not just about stress and overwork. And there is a term that many find helpful, in my experience, that is called a moral injury. And I would say that many of us also suffered moral injuries at work through this period. And this is when you are, required to make a decision that affects the survival of others, when all the options lead to negative outcomes or disproportionately affect certain groups, or having to do something that goes against your beliefs, not being able to do something that is in line with your beliefs, or seeing that in leadership. So I would say that, making decisions about prioritizing limited supplies of vaccines, that is a moral injury. Having to prioritize who can receive a medication-assisted therapy, and then also, just the act of, taking care of yourself, knowing that there's still so much work to do and feeling that your decisions are affecting the survival of others, moral injuries. So I hope that is something that is helpful to you. This is a term that is used in other areas, such as our military and in healthcare, where really our actions are so much larger than ourselves. It helps to have a context for what that is and what that does to us personally. So what we found in the Public Health Workforce Interest and Needs Survey is that, for the most part, the overall mental health and well-being of most employees is still quite good. But I would say that, 20 to 25% of our staff in public health are still reporting that their mental health and well-being is fair or poor. And that's a significant number of people. In region 1 and 2, in which Maine is, the reported poor and fair emotional and mental well-being was slightly higher than in other regions, and that's important to note. And in the Maine Public Health survey, there were a lot of agreement that there were some supports for mental health and well-being, but that there is maybe not the policies in place, and that there is a significant opportunity to improve here, I think, nationally, not just in Maine. And I think an interesting finding from this survey was that there really wasn't a statistical difference based on your length of time in public health or in terms of your organizational role. So mental health impacts everyone. It doesn't matter your role. It doesn't matter how long you've been in public health. Having mental health challenges can happen to any of us, and does happen to most of us at any given time. And then I just want to point out that there is additional layer where, we, I think, recognized more during the pandemic how deeply embedded racism and bias and discrimination are in our systems and structures, including our workplaces. And so I would just note here that, it is really important for us to continue to focus on building inclusive and fair cultures where diverse people and perspectives feel included and that they have a sense of belonging. But I would add that there is additional burden for marginalized groups and people of color who experience bias, racism, discrimination in their workplaces, and in even interactions with colleagues that are, I think, contribute an additional layer to all of this moral injury, overwork, stress that we have in the workplace. And it's important for us to keep in mind when we're thinking about where do we go from here? And then again, in your Maine Public Health Workforce Survey, there is, I think, a strong emphasis to address and prioritize diversity, equity, and inclusion. And yet I think that there is still not enough being done from some respondents in thinking about how do you respond within your workplace to that type of discrimination from a policy perspective. And so there's another opportunity there. Bullying, harassment, undermining came up also in the work with the communities, and in the public health WIN survey, what we found was that there was a lot of harassment that increased during the pandemic related to how people were performing their duties at work. And here, slightly better news for region 1 and 2 was that this experience was slightly better than the national averages, but still obviously very unacceptable. And so what does all this mean? What we're finding is that 60% of the public health workforce reported at least one symptom of post-traumatic stress disorder in the workplace. And you can see on the screen here where regions 1 and 2 performed and compared to national averages. And just wanted to point out here that 16% of the workforce reported 4 or more symptoms of PTSD, and that's really important to be thinking about. So I feel like now everybody's kind of like, you were feeling optimistic and really excited about being here this morning, and you're thinking, oh my gosh, I knew it was bad, and thanks for confirming that. So let's move on to something slightly more positive, which is, what can we do about this? Because we need to do something about this. This is important, and that is what I hope we have established at this point. So when we're talking about resiliency at work, what I wanted to offer is a definition so that we can know that I'm not talking about never having stress at work, never having periods of overwork, never having experiences that challenge us emotionally, physically, spiritually in our lives, because that's not life, right? But what resiliency at work is having the stamina or ability to withstand, recover, and grow in the face of stressors and changing demands. And the things that we know that can lead to this kind of resilience are optimism, being able to manage emotions, having a sense of safety, and having strong connectedness or a strong social support system. So I would say that the key to well-being and resilience is not never having these blips, these moments where you are tried, but to have periods where you're trying very hard, and then you take moments for recovery. And rest and recovery are not the same thing. So during the pandemic, we tried to pay a lot of attention at ASTO to how are we supporting staff resilience and well-being. And we were not on the front lines of the response. We were in a supportive role to our public health agencies and members. And our staff, while they worked some from home prior to the pandemic, went fully remote, much like the rest of the work world, who were in roles that could be working from home. And so we pulled together a work group to really think about what are the ways that we can support staff as they are working from home with new stressors of, caring for others at home, not having access to many resources that they had typically in order to accommodate their personal and work lives, and often through sickness or the sickness of family members. So we incorporated things related to wellness and connectedness. We dramatically increased the communication, starting with weekly staff meetings. We previously had them monthly. Starting a new staff e-newsletter, having social hours every week. Our CEO, Mike Fraser, offered a coffee chat on a biweekly or monthly basis, depending on the timing. We started incorporating some things into our policies and practices that really allowed people to have more boundaries around their work days. And that was really important. We got a lot of feedback about that. In terms of like schedulings, only having 30-minute meetings or 45 minutes at most, giving people at least a break between meetings, meeting-free Fridays for internal meetings. And we also had some fun together. We had a family story time. My twins were 5 years old at the time the pandemic started, and we would have a family story time at 1 o'clock. So those who were still napping had an opportunity to hear a story and then go take a nap. So just recognizing the fact that many of us had responsibilities in the home and at work at the same time, or trying to blend that a little bit differently. And at the same time, we were thinking, how on earth do we support these public health officials who now no longer have time to engage with us on voluntary public health work that impacts us as a nation and all states? So we thought about how we could provide what we knew about resilience and well-being and how we could support our public health officials and the public health workforce a little more broadly. So we provided executive coaching support to our health officials that were focused really on resilience. We offered a course called the Burn Bright, the Resilience Advantage for some of our deputy director roles, those who are in executive positions under state health officials. We also partnered with the National Council for Mental Wellbeing to offer a checkup series for leaders to connect and share their experiences of what they were going through and how they were going through things. And then we tried to help people reconnect to why did we get into this in the first place through a webinar series that was really focused on inspiration and insight. So all of our leader development sessions now have a resilience focused component, whether that's physical, mental, spiritual. We really are attempting to build our meetings in a way that focuses on well-being. And as part of that, we started seeing resources that were going to other sectors, like that, primarily the healthcare sector, that would allow for for professionals to start addressing the well-being and resilience of those workers. And while it's very important that healthcare workers have those needs attended to, we really didn't see the same thing for the public health workforce. And so we went to CDC and said, we'd like to build on, these pieces that we have been putting together and build a new program for our public health heroes, our public health workforce, and to really think about can we more comprehensively support a culture shift within workplaces that will allow for people to have greater resilience at work, using an equity framework and being trauma informed in our approach. So we received a little bit of funding to support our efforts, and have been working since February to rapidly try to gather the best evidence that we have around resiliency in workplaces. And much of it comes from the military, from the healthcare sector, other sectors that typically experience this type of thing in their day-to-day work. And our goal is to create a website with resources that are focused on 3 levels: individuals and personal resilience, supervisors, and the environment that they create for their teams, and for agencies to really think about the leadership role and the policies that will address those factors of burnout. We are working with 5 pilot states to help them in planning and prioritizing interventions and providing them with access to resources through this pilot period. But one thing that we will share in follow-up to this webinar are the resources that we have collected through our new website that will be launching early next year. And really what we're trying to better understand are how policies and practices impact burnout through typically these national surveys, to support individuals in adopting better self-care and stress reduction strategies, to really focus on those leadership and management skills that really make a difference at the team level and in agencies, and to really think about how do we change systems, practices, and policies that promote mental well-being in workplaces. And those are not, offering yoga at lunch, just so you know. So what we found is that there is a pretty limited body of research, especially when it comes to the application of these in government agencies. So while many of these strategies we think can be adapted into government agencies, we do think that there is a greater need for a research agenda around how do you do these best practices in the government sector. And we are building our approach on this framework for well-being and sustainable performance that looks at, from a socio-ecological model perspective of, an individual, peers, organizational, and then this ultimately societal expectation that we have around work and work-life balance or integration or whatever you have these days. So one thing as we move forward, I want to ask you to do is to start adding into the chat things that you do for your own personal well-being and resilience. And I know we're running a little bit behind, but maybe Becca, we can in a few minutes add some of those share some of those out loud as we move forward. But I think that what's important here is that there is an individual responsibility here, much like everything. And we do need to put on our own oxygen mask before assisting others. And so this is your visual reminder that that is not only okay, but required in this moment. So you should really think, how many hours of sleep did you get last night? When was the last time you moved your body for real physical exertion? What was the last thing you ate to fuel your body? How are you practicing mindfulness? When did you last express gratitude? And maybe when did you last laugh? These are things that you can do on a daily basis in building your own personal resilience. And the thing I would note here is that rest and recovery are not the same thing. And I said that earlier, and I'm repeating it because how many times have you gone to sleep and woken up just as exhausted as you went to bed? I think we probably all had that experience, but building in enjoyable breaks, making sure that find some connectedness with another person, engaging in mindfulness. All of these things are evidence-based approaches to building your own personal resilience. And so, Becca, has anybody added anything into the chat at this point we can share?
Yeah, we're getting some great comments. Meditation, walk in the morning before work, and cooking with friends, reading every night to unwind from the day, walking throughout the day, a couple cyclists, or any kind of exercise, just getting some resistance training in, yoga, journaling. So, a whole range of different types of activities, being outside, eating lunch outside.
Wonderful.
Great range. Yeah.
It's really important to think about, what do you do that makes you feel better, and to really purposefully do those things as part of your day and part of your week. And if you can't think of anything that, brings you joy or makes you feel good, think back to when you were a kid, and, what were some of the things that you did that always, put a smile on your face, or you always went to bed happy when you did those things? Is it connectedness with a certain group of people? Is it part of your spiritual practice? All of these things have great evidence that they are supportive of our own personal well-being. And then there is a book called Burnout: The Secret to Unlocking the Stress Cycle that also offers ways personally that you can deal with stress at work. Some of this is about analyzing problems and making a plan for how you're going to approach the problems that you're experiencing at work, reframing a problem and saying to yourself, this is difficult, but it's also worth it. And so that helps you to push through stress in the workplace. Knowing that, a struggle can increase your creativity. And I think we saw tons of examples of how people could be so creative in reaching communities, in our accomplishing our public health goals throughout the pandemic. So turning that lens to our workplaces, I think, is a great opportunity for us now. Redefining winning so that maybe the long-term goal is too far away, but finding some way to get there incrementally will help us to deal with the stress. Considering when to stop or quit, and understanding that letting go is not the same as failing, and that sometimes the benefits don't outweigh the negatives, and that there is a need to make a change. And then making meaning from your experience. And what I want to offer here is, I call it a Mad Lib, but the authors basically created this framework that says, how do I look back on this and ascribe some meaning to what I went through? So here they offer, even though I couldn't control this thing, I managed to survive through this tactic. And then I used this resource to grow stronger. And now I can do this. So just even having that opportunity to fill in the blank and think about, what has changed in a positive way that has helped me to grow into who I am today, can help us to really think about how we're managing our own stress. Another thing that we can offer from the literature is that peer support and formal peer support is really important for resilience and well-being. And you probably have those people at work. They are your go-tos. They are the people that help you through stressful situations. Maybe that is a formal peer group like this in this public health association, or maybe it's a group of people who aren't even in your industry that you connect with to work through professional goals with. But here, what we see is that formal peer support is very effective for resilience in agencies. And so, if there are employee resource groups for staff that are in similar backgrounds or experiences, there's a lot of precedent for this in high stress settings. You can see in Google wingmen in the Air Force, shipmates in the Navy, and the Google Blue Dot program. So you see it in the military and in the private sector. And then on the left side of your screen, you'll see this mental health first aid at work, which many of you may be aware of mental health first aid. There is a shorter program that is much more workforce oriented, that is really around how do you formalize peer support for mental health in a workplace. So lots to think about and do here. We talked a lot about the role that supervisors play in workplaces, and supervisors are significant in work life, whether you are one or have one. Improving supervisory skills is really important to address those reasons for burnout, and they're really important for normalizing conversations about mental health and well-being, whether it's sick time is totally appropriate use for a mental health day, or how you communicate with your staff about how you manage your own personal resilience. Supervisors really set the tone for the workplace experience that staff have, and this is a place for us to invest in where there is significant evidence. Promising leadership approaches are always, in any sort of culture or climate initiative, leaders have to walk the talk. When you're saying one thing and sending out emails at midnight, people are reading those emails at midnight. They are seeing from your actions what the expectation is. And so it's really important for leaders to know that staff are watching and they are following in your footsteps regardless of the words that you're using. So leaders can help in normalizing conversations about mental health and resilience, to talk about the experience that we've been through in the stress of working through this pandemic, and can really, model what it looks like to practice personal resilience while also championing the organizational changes that need to take place, that normalize our workloads, that normalize our work hours, that normalize mental health and well-being at work. And then at the organizational level, here are the things that we have found have evidence that support the types of changes that we need to make. So fair compensation and performance is not something that we've talked about yet, but is often something that comes up within an organization. All of the HR policies that address people practices have an opportunity to be looked at. In one of our public health hero site visits, we were talking about the supervisory role, and one of the members of the executive team said, the only thing that my job description says about my role as a supervisor is that I supervise X people. So, the emphasis that we put on that very important role definitely impacts, how people feel in those roles about where they're supposed to be spending their time. So, whether it's a comprehensive worksite wellness initiative, or whether it's a policy that really describes the expectations of supervisors in creating an environment where there are fair and balanced workloads, where people are, taking advantage of the employee assistance programs. These are things that you can do from an organizational perspective. And I want to begin to close here by saying, we've been through a lot, and this is a moment where a lot is possible. And so we can keep going and keep, adding to the expectations of how people perform during public health emergencies, or maybe we could do something different, whether that's for ourselves personally, whether that's for the people that we supervise, or whether that's for the agencies that we're working in. What is really possible here? The world is changing. The workforce has different expectations. So I would say that this is the moment of reset that we've been waiting for, and we can take advantage of this and find meaning for what comes next. So a couple of things that you could do that we've talked about today are to really focus on your own personal well-being, and maybe that's enough for where you are today. Connecting to and supporting your peers. At the beginning, I challenged you to have a conversation with somebody that's more than, hey, how are you? Good. So maybe that's something that you could do today. Take steps to improve your own leadership and supervisory skills. And I say this in the spirit of, I don't care what your position is in an organization, you are a leader. Lead from where you are. Support or bring about some of the organizational changes that are needed to address these factors of burnout. and to create space for mental health and well-being in the workplace, and thinking really about what meaning can you make from your own experience. So my challenge to you is to pick something, do something different, see what happens. And I'm happy to answer any questions that you might have, and would love to hear some of your own experiences at this time.
Thank you, Amber. That was great. You covered a lot of different aspects of burnout and in different dimensions. And I think some of the terms that you use in different considerations, like leading from where you are, I think those are really valuable pieces of insight for us as we reflect on our role in our organizations, but also in our social networks and our families and other places where we spend our time. So I encourage folks to use the Q&A feature if you do have any questions that you have for Amber. And in the meantime, I do have a question for you. So I think about that bell curve of that describes our engagement. And at one end of the bell curve, it's boredom, where we're just, not really stimulated by what we're doing. And then the peak of the bell is when we really feel like the demands that are being put on us match our capacity for responding to those demands. And then at the other end is burnout. And I just think about that curve in the context of your presentation. And when as you've researched this field and been reflecting on programming and opportunities for individuals and organizations, are there kind of trigger points that people can pay attention to as they're moving from that place of peak engagement to start on that burnout piece? Because there's so many different dimensions to burnout, as you were saying. Did you see anything in there that could be helpful for folks to kind of reflect on as they're going through their day-to-day and trying not to get to that point where you really do reach burnout?
I think it's a great point, and I think there are, as you said, many layers to it and many points for intervention. But I think one opportunity would be just to think about a moment in your work life when you felt that peak and what that was like, and to talk with your supervisor about what was the context of that. Was it work that you really enjoyed, and in the quantity that made sense? Was it a sense of like challenging but not insurmountable deadlines, and really having conversations about what you may need now at this point in order to either move away from this boredom and disengagement piece or this burnout piece, which I think are not that dissimilar.
Yeah, I agree. I mean, they're both disengagement and not good for our health.
Mm-hmm.
And I think too, as we reflect, like I loved the examples that you gave from what Ashto was doing, like the storytime hour. I'm sorry, Heather, I didn't think for us to do that. We didn't think it's a great idea. So as those opportunities came up, how were they sourced from the staff or from leadership? Like, how did that happen? I'm just trying to think about folks who are listening in and may want to incorporate some support mechanisms like that in their organization. Can you just talk a little bit about how that came about? Those were really creative, I thought.
Well, I think necessity is the mother of invention. And for me, it was, we needed to incorporate story time into our e-learning experience with my twins. And so I said, well, everybody else is doing this. I wonder if we had some sort of story time together, if this would be something that people would participate in. And honestly, the people loved it. Our workforce is a lot of women in childbearing ages. And so there were many children at home with us as we were working through the pandemic. And so I think it was not just the story hour that was important, but it was the acknowledgement that we were balancing two things that aren't typically allowed in a workplace. I think for many women, you feel like you need to not ever have children or mention children in a workplace, where, this was an acknowledgement that, hey, there are children here, and we're going to have executives, in fact, take the time to read to the kids that are part of our organization, and the families that are part of our organization. And even staff without kids participated. But I would say how that came about was our incident command system. And so we had a work group that was really focused on staff and organizational supports. And so that group started this, coming up with, we had someone lead mindfulness sessions. We had coloring break time. We had, things that staff volunteered to lead with their peers as a space for connectedness and for really taking breaks and acknowledging that we need those breaks and creating a space where it was safe to do that. And then from there, we actually now have a resilience staff work group that, are now planning what we're going to do over through the month of November around gratitude, which has very strong evidence in terms of resilience and well-being. So, I think this is something that's contagious, that people are like, well, if we can do these kinds of things in the workplace, what else could we do? And it helps people to really think about, what would they like to see there, and to bring that forward.
Yeah, I agree. That's great. I completely agree about the contagiousness of it. And there's a comment in the chat just about their research of burnout on isolation. And I think a lot of what you're talking about is about connectedness. And like you said, even people who didn't have kids participated. So there is that social connectedness component to that, which can help. We're going to take one more question. And this is, what is the one, if you had to say, what is the one most important thing a public health organization can do to aid professionals experiencing burnout?
Oh, such a good question. Oh, if I can only say one thing, I would say it is to acknowledge that the workloads are not sustainable, and to really question some of the assumptions that we've made about what are the expectations of public health work, particularly in an emergency, and how we, really think about what are the things that you can do from an organizational policy perspective that create an environment where people can contribute their best every day, and really pay attention to that, because I think that there are a lot of assumptions that we've brought to this around busyness, and that adding things doesn't take anything else away from our plates, and the sense of deadlines being these fixed things rather than arbitrary in many cases, and so I would just say that from an organizational perspective, opening the door for this conversation is really critical at this point.
Yeah, that's great. Thank you, Amber. So that was our last question for today, but I just want to thank you, Amber, so much for being here with us this morning. This was an incredible presentation, and it was so helpful to hear about your experience at your own organization, but also the research. And I think thinking about the results of Maine and Region 1 and national data on this. And I hope you all will join us for our next session. We'll be hearing more about we'll be diving deeper into the results of that public health workforce survey. So thank you to Amber, thank you to Tom and to Northern Light Health for being our keynote speaker sponsor. And thank you all for bearing with us. I thought that Mercury retrograde ended a couple of weeks ago, or maybe last week, but it seems to still be kind of hanging on. So hopefully we're free from glitches, and we hope to see you all soon. We'll be rejoined at 9:40. So take a bit of a break, and we'll see you soon. Thank you very much.
Thank you.